I have no nausea. Is something wrong? Some patients would ask that. Pregnancy changes when when a patient gets pregnant. Generally, the symptoms go like nausea, breast tenderness, sleepiness, bloating, sometimes lower abdominal pain. These are common pregnancy changes and they vary from patient to patient. Some patients would have immense, like the nausea is so much that they can't eat anything. They don't allow themselves, they just get very distressed by it. And some of them manage it through. They don't take a single pill. They're like, okay, I notice it, it's really bad, but I'm fine. I think I can manage. I puke sometimes, but I'm overall okay. So it's a very subjective thing, nausea, as a feeling in your body and your ability to handle it. Now, it has been seen that if you have a good amount of nausea or any nausea, that probably your baby is good. And we have seen it that some patients who have had miscarriages, they have said very specifically, I had no symptoms, I had no nausea. They have said that. So if I say that to you, what does that mean? What are you making it mean? Like if you are pregnant right now and you don't have any symptoms, does that mean it's a miscarriage? Because I have also had patients who have had zero nausea. They're like, no, I don't feel pregnant. And they've had a baby, a 9-month baby. I have seen patients that way too. So when I say that, because it's a subjective thing, like I would want to question, like maybe did I ask her properly? Like, does she know what nausea is? But why think that way? What's the point of thinking that this amount of nausea is probably going to be good enough? And what if you don't have nausea? So if you don't have nausea and you're thinking that what if it's a miscarriage, then I would want you to go to that place. Yes, what if it is a miscarriage? What are you making it mean about you? Because are you thinking that you're not good enough to have a baby, or you're not capable to have a baby, or why are you so unlucky? What's wrong with you? Why is this happening to me? If you're having those thoughts, have compassion for yourself. It's just your brain trying to protect you. You still don't know if it's a miscarriage. So if you spend time thinking these things, which are going to come as a human being, if I am pregnant and I don't have nausea, I would be worried too. But worrying has always been of no use. There is nothing good that comes out of worry. So when you are pregnant and you don't have any nausea, you have only two things going on. Either your baby is fine or your baby is not fine. If your baby is fine, your brain would want to be like, but I want to know if the baby is fine. You can never know. Even if you do the scan and then your baby's heartbeat was present, I've seen patients just disappear. The heartbeat just disappear. You can never know. The whole 9 months, honestly speaking, you can never know when things can just disappear, because that's pregnancy. So having said that you can never really know if your baby is going to be fine, would you like to believe that oh no, my baby is going to die the whole 9 months? No. Why would you do that? Instead, you can choose to believe something like, okay, I don't have nausea, I don't have these symptoms, and I'm okay with whatever happens, because that's not going to stop me trying, because I want to be a mom, period. That's it. And there is a good chance I got pregnant, that's good. So if I'm pregnant and I can still have a baby, I'm going to keep trying. And I am pregnant right now, and there is still a very good chance that this baby is going to be fine. So I'm going to choose to believe that this baby is okay. And notice how your brain keeps telling you otherwise, and just shush your brain for some time. Like, I know what you're trying to do, that's fine, but I'm going to believe that this baby is fine. Like, because maybe it's fine. How do I know it's not? All right.